Good afternoon, everybody. My name is Jamie Remmers, and I am the Assistant Director for International Student Engagement and Graduate Life at NYU, housed in the Center for Student Life. I use she, her, hers pronouns, and I'm delighted to welcome you here today and be your moderator for today's conversation. So some logistics before we get started. You may notice there's a toolbar at the bottom of your screen. You'll be able to use the closed captioning feature should you wish. You'll see it below. And you can also know that there's a Q&A section. You can ask questions at any point during the conversation today, but we'll be using the Q&A portion for the last 15 minutes of today's event. Before we begin, I'd like to take a moment to acknowledge the land on which NYU occupies as the original home of the Lenape people. We take this opportunity to thank the original caretakers of this land. Without the presence of Indigenous peoples at NYU, in the city of New York, and across Turtle Island, we would not have access to this institution and gathering space to be in the dialogue we are in today. I'd also like to take a 10-second moment of silence to honor the lives and legacies of those who have gone before us and whose land we presently live on. Thank you. So the intent of today's conversation is to specifically discuss how the coronavirus pandemic has affected queer and trans community, specifically queer, trans, Black, Indigenous people of color, or QT/BIPOC, and how many of the LGBTQ+ community are doing such important and essential frontline work to fight the pandemic. QT/BIPOC, specifically Black trans women, femmes, and Black trans-led organizations are also at the front lines of important activism, leading protests and rallies across the country, such as the March for Black Trans Lives, most recently organized in front of the Brooklyn Museum with well over 10,000 attendees. This year, we celebrate Pride with unwavering support and solidarity with movements against anti-Black racism. As we aspire towards our collective liberation, we must do so from an intersectional approach that includes a steadfast commitment to racial justice and trans justice. We understand that this subject could be an entire collegiate course, and we will do our best to tackle all of these themes in the next hour. Today, we will hear from folks on the front lines doing the work to combat the coronavirus. We hear from folks who are treating people affected by both pandemic and systemic racism, and who are studying racial disparities specifically in healthcare. We'll hear from community organizers about what we can do as queer and trans people and allies to find spaces for community in this virtual world. We'll also hear from one of our very own from NYU about how students can be connected and supported during these challenging times. So I'd like to bring out our amazing panelists and thank them so very much for joining us here today. You'll be sharing your experiences, your insights, and your advice as we navigate these topics, and we are so appreciative of you. So first, I'd like to welcome each panelist, say their name, a little about who they are, and their affiliation with NYU. And I will first welcome Renee Riopel.
Can you see and hear me okay?
Yep, looks good, Renee.
Amazing, it's always great when technology works out, right? So my name is Renee Riopel, my pronouns are they, them, theirs, and I graduated the Silver School of Social Work in 2012. I'm a mental health therapist at Montefiore Medical Center in the Bronx, working in the adult AIDS clinic in the Oval Center, which support LGBTQ and HIV affected folks. I'm also a group clinician for the Ackerman Institute's Gender and Families Project, and I'm in private practice. So I'll be talking a little bit from the mental health perspective and wellness today.
Awesome, we're really happy to have you, Renee.
Thank you so much, Jamie. I really appreciate you and Student Life for putting this together.
Of course, thank you. Next up, I'd like to invite out Michael Gamber.
Hey there, I'm Michael Gamber. I use he, him, his pronouns. I'm an alum of the School of Professional Studies, where I'm also adjunct faculty. So after graduating, I began volunteering with the NYU LGBTQ+ Alumni Network Board of Directors, where I've served as co-president for the past 2 years. And for my day job, I'm the Volunteer Relations and Training Director at New York Cares, where I lead a team that's responsible for ensuring an optimal volunteer experience for over 50,000 volunteers. And our organization works alongside New York City Emergency Management and many city agencies doing our pandemic response currently. So I'm very honored to be here today, and I look forward to our conversation.
Thank you, Michael. So happy to have you. Okay, next up, I'd love to invite out Ravi Kasari. Hey, Ravi.
Hey, everybody. My name's Dr. Ravi Kasari. I'm a clinical assistant professor of medicine at the NYU Grossman School of Medicine. I'm also a hospitalist at Tisch and Kimmel Hospitals, and I'm also the co-chair of the LGBTQ plus advisory committee at NYU Lincoln.
Thank you so much, Ravi.
Thank you. Yeah, thank you for having me.
Okay, and I'd also like to invite up Christopher Griffin.
Hello, 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 everyone. My name is Christopher Griffin. I use he, she, and they pronoun, and I'm the assistant director for the NYU LGBTQ Center. So I have the wonderful opportunity to work with all of the amazing students that access and utilize our center, mainly around programming, student group advising, training, all that great stuff.
A lot of great stuff. Thank you. I'm so happy to have all of you in conversation today, and let's get started. All right, so the first question is posed to the entire group. How has your life been impacted since COVID-19? I know, it's a heavy one. So let's start with Renee. Do you want to kick us off?
Yeah, absolutely. I don't know about the rest of you all, but I feel like things changed. It felt sort of overnight. And really rapidly in terms of how I'm able to best show up and support folks and what my practice looks like. So because I'm in a hospital, I haven't stopped going to work, but everything has moved to telehealth or phone support for folks. And I think that's both positive and negative impacts for communities who maybe otherwise wouldn't be able to reach services, right? And so telehealth has increased that, but I also think that especially in New York, where privacy is scarce at best, that this has really impacted folks' ability to seek medical and mental health care. I think the other interesting piece of this is because we're doing video visits, we're sitting like with people in their homes essentially, and there's like this increased intimacy that's happened, but also the intimacy of like this parallel process, like we are all experiencing something collectively, and we don't all have the answers, and so being very, very vulnerable with that.
Thank you. Michael, would you like to go next?
Sure. So first, I must acknowledge that I am extremely fortunate that I've been able to retain employment during this time, and I've been privileged to have access to medical care, resources, and only had mild symptoms with the virus. Many people say that because this is a global event, that we're all in the same boat, but a better analogy would be, and what I've heard, is that we're not in the same boat, but we are in the same storm. And that's an important distinction because we're all experiencing hardship in relation to our normal way of life. But from a socioeconomic standpoint, what's normal is great hardship for many. So New York Cares works to address the hardship in the city's most vulnerable through programs that meet immediate needs, improve education outcomes, and revitalize public spaces. However, in times of disaster, our organization works alongside the city in relief efforts. So in March, after working to ensure that our staff was safe and secure, we began relief efforts. At the same time, like all faculty, I worked to move my course instruction online to ensure a comparable learning experience for my students while keeping them safe through social distancing. So I've had a great deal of privilege during this time. And while I have had that, it has been a challenge. I would say in normal times, mental health is something that I really work hard for, and I support wellness through being present in the LGBTQ plus community, keeping clear boundaries with work, and a lot of group fitness. So without those things, I've had to work a lot harder on self-care to make sure that I can support my family, my friends, and put my all into our relief efforts, and continue to create community among our LGBTQ alumni network. So I've learned a lot, and I continue to learn a lot. I was primed for a myriad of disasters professionally. Ahead of this, experienced blackouts, severe coastal storms, and 9/11 here in New York City, but pandemic really wasn't in the playbook. Personally, I've learned more tactics to keep balance and distance with my work to avoid burnout and to ensure that I can support the community in the long haul.
Thank you so much, Michael. I really like what you said. It's the same storm, but different boats. Thanks for that. Ravi, would you like to go next?
Yeah, sure. I think the way that I would describe how it's been so far is chaotic adaptation. When this first began, there was just so many changes happening very rapidly in terms of the research and literature that was coming out, what treatments we would be doing, the way that we would use PPE or the way that we would isolate patients. I actually cared for the first patient that tested positive for COVID at NYU. I had to retrain myself in critical care medicine so that I could work temporarily as a critical care attending. And that was just like the clinical side of it. But on a more personal aspect, I had to ask myself some pretty tough questions of, given my risk and how many patients I was exposed to, was it appropriate to come home to my partner? Was it okay to ever see friends? And so I had to ask myself, really tough questions. And also my grandmother was hospitalized in April, luckily not for COVID, but she had to go to a nursing home or a rehab facility afterwards. And the whole time it was just very stressful just to think about what could happen, especially after seeing how lonely and devastating this disease can be for some patients. But I think that overall I was just, happy to be able to help out during a crisis.
Thank you for all of what you've done so far. It's very brave and we admire it. And we're so happy that you're part of this today. And Christopher.
Yes. So personally, I've been focused on family and my own mental health and making sure that I'm taking care of myself so that I can show up for other folks. I have family members with compromised immune systems, so just making sure that they have all the information that they need in order to care for themselves. And they're also in Philadelphia, so and I'm in Brooklyn, so making sure that I'm taking the time to just show up for them in all the ways that I can. And then professionally, a big question, not a question, something I've been exploring really is how can we continue to build community and show up for each other and engage in community care through, virtually, right? So how can we be innovative and creative in those ways and utilize technology in all the ways possible to continue to do the work, because the work is still there. And so that has been, something that's I've been continually thinking about. But then also realizing that this pandemic has, I think all the things that are surfacing have always existed, right? Anti-Black racism has always existed. Homophobia has always existed. Transphobia has always existed. All these things are insidiously ingrained in our society. And I think this pandemic has brought some of those things to the surface. And so it's just really interesting to see these things rise and grab the attention of folks who may not have been paying attention prior. So it's been real interesting on that front.
Yeah, and thank you for that. I think that's going to be a bulk of our conversation today, is how this pandemic has really manifested a lot of that. So thank you, each of you. I'd like to now maybe turn to Renee and ask a few questions. So Renee, as a social worker with so much experience in the field, can you tell us a little bit about access to resources, particularly mental health and community support resources, when somebody's quarantine space may not be healthy or safe for their gender or sexual identity?
Yeah, so thank you for that question, Jamie. And I really appreciate what you said also, Christopher, and that I think access to resources, access to safe, quality, affirming, loving mental health and medical resources has always been a concern for our community, and particularly for Black and Indigenous folks. And so in thinking about that, it's also important to remember the ways that our community is unceasingly creative and connected. And I appreciate, Michael, also what you said about remaining connected to community, because building infrastructures to caretake one another outside of systems is something that now more than ever I've seen folks dedicate resources to, and I think that's really important right now.
Thank you for that. And I mean, Zoom has done so much. I mean, look how we are right now. So thank you for that. I have another question for you as well. So the next question is about the ability to shelter in place as a privilege. So what does this mean for trans and LGBTQ folks who might not have that privilege to shelter or to do so safely and healthily?
Yeah, so I think this is something that we've always known, that just because somebody's living in a particular place doesn't mean it's healthy emotionally, mentally, or physically, right? And particularly for folks who are unable to live as their full-fledged selves, or it is otherwise unsafe or downright violent to exist as an LGBTQ or HIV affected person in your home space. Then saying take your entire life and move it to your home space might increase violence. And so I think some of the things that I've been trying to assess for myself, for folks that I support, is what does risk actually mean, right? Like, yes, we can talk about the risk in terms of COVID and of medical concerns. And also there is a risk to folks' mental health and physical well-being for existing in certain spaces. I think this is also one of those opportunities to be particularly creative, right? So now that we have access to technology, if folks do have access to technology, what are we doing as people who hold positions of privilege in institutions to like leverage that privilege and technology and help it or allow it to work for people who wouldn't otherwise be able to access care.
Thank you, I appreciate that. Another question for you. So we may have already experienced and engaged in mental health care way before COVID-19 happened. How has the coronavirus changed the landscape of healthcare support for trans and LGBTQ folks, including mental health care, and what may have remained the same?
Yeah, I mean, I think what's wild is like, just because we're experiencing a collective acute crisis doesn't mean all of the stuff that you were accessing therapy for has disappeared. You know, or maybe it's changed, or maybe it's been exacerbated, right? And so we think also like that anxiety hasn't gone away, just, you know. But also some folks may be accessing mental health care and therapy to access other gender affirming lines to medical care, which is also life-saving care, and I think equally important. So some of what's changed is, I think, the increased isolation in a community that can also always sometimes feel isolated is really hard, right? So losing that access to LGBTQ specific spaces, sometimes sitting in a room with your provider or your doctor might be the only access to LGBTQ folks or folks of color that you have for some time. And so I think it's important to acknowledge that has perhaps increased. And I know, Michael, you're going to speak to the importance of that also. But also the other piece of this that I find interesting is I think this is the first time that I have heard cisgender, white and heterosexual folks saying, oh, I'm unable to access healthcare, or I'm concerned to be in public spaces. And I found that really interesting because I think this is something that particularly queer and trans folks of color have needed to navigate and establish safety around for some time. And so in some ways it's relying on these skill sets that unfortunately we've had to create, but also have been able to utilize in this time in a different way.
Yeah, thank you. That's a very insightful point. I have one final question for you as well. And this is kind of more pertinent with the times, with what's going on. So thinking about moments of revolution and resistance, how can one keep safe or safer, including protest mental health support, both before and after protests, and other means to attend to mental health? And what about specifically for Black and Indigenous individuals?
Yeah, so I think it's important to contextualize, like, we're coming off the tail end of a pandemic, which is like baseline anxious for most people most of the time. And so at least something that I'm trying to do for myself, as well as talk to folks about, is like being real and honest and checking in with yourself, because this movement, this is a long game, right? Like this is a long haul that I think we're going to need to reflect critically on how to best utilize our resources. And so if you are feeling depleted, if you are feeling overwhelmed, if you are not in a good mental health space, it's really important that you be honest with yourself, right, about what advocacy then can look like for you. And I think we often talk about advocacy as like big A advocacy, like we're going out in the streets and we're marching and we're protesting. And also there's little a advocacy, which is like, you know, bringing water to people and writing your elected officials, right, and lobbying, right? And so this is a spectrum of things. This includes voting, maybe, if you're living in New York tomorrow. Like there's a spectrum of things that people can do to meet themselves where they're at. It's also, I think there is an urgency that can sometimes cause folks to make compromises in their physical and mental health in order to be part of that, right? And so it is important to check in with yourself and say, like, am I drinking water? Am I taking my meds every day? It is important to hold time for yourself. We're gonna be dropping in the chat, and I think a little bit later, also some specific mental health resources for Black specifically and Indigenous trans queer folks. And so I think those are important to check out as well, and uplift the voices of Black and Indigenous mental health providers.
Awesome. Thank you so much, Renee, for the work that you're doing, that you will be doing. We appreciate you. And we could probably pop those links into the chat sooner than later so folks can access them. So just take a look at your chat box. And just a friendly reminder too, you can use the Q&A feature at any point in the event. So if you have a question for Renee, you could pop in the Q&A section and we will look at them in the final quarter of today's event. So next I'd like to talk with Michael. So Michael, can you speak to the ways in which you serve the community, specifically LGBTQIA+ and Black and Indigenous groups, and how that's been affected since COVID?
Yeah, absolutely. I'll do this through the lens of our relief efforts and then in relation to the LGBTQ+ community and intersectionality. I have to give you a little bit of context about how organizations work in disaster relief. There's a clear order of operations to the work that we do. One, we want to address and ensure all of our staff safety and secure their resources. We want to address our current programming. We want to respond to unique needs with new programming, and of course, raise funds to continue our relief efforts. So the most critical programs we had to ensure were those that address food insecurity. So we support a variety of hunger programming, as over 1.2 million New York City residents are food insecure. So that's 12% higher than the national rate and 21% higher than the rest of New York State. So the pandemic exacerbated this issue in two main ways. Some of the organizations that provided meals were no longer able to operate safely. They might have been too small. And people's incomes were affected, which affected their ability to buy food. And in times of disaster, existing inequality is just magnified. So that means our communities of color are disproportionately affected. From an intersectional lens with the LGBTQ+ community, roughly 9% of LGBTQ+ folks were unemployed compared to 5% of all Americans before the outbreak. About 27% of LGBTQ people were food insecure compared with 15% of all Americans. So when we started out, we estimated that we would need to support around 300,000 meals through the course of the pandemic. Since March, we've supported 1.5 million, and that's more than we would do in a typical year. So since the disaster is unlike what we typically would prepare for, like a coastal storm or a terror attack, it didn't follow a traditional profile of disaster response, which is pre-impact, if you know about it, like a storm, impact, post-impact, and recovery. This pandemic has affected all areas of the city, which meant that we had to lock down all over, whereas it would typically be a short duration and limited specific area. So pre-pandemic, isolation was already a major issue with our seniors. And during the pandemic, this issue, again, is exacerbated. So to address this issue, we actually took a cue from telehealth. Thank you, Renee, and those who do work virtually. We created a phone bank program to connect volunteers to socially isolated seniors. So this program did two things. One, it assessed their access to critical services like medical care and food, and also it provides some friendly conversation to prevent isolation. So like with food insecurity, the isolation of seniors disproportionately affects communities of color, and with LGBTQ older adults, they are twice as likely to be living alone and 4 times less likely to have children compared to people the same age who aren't LGBTQ+, which means that they're especially at risk during a pandemic. So when we hear people talk about getting back to normal or getting communities back up on their feet, the reality is that before the pandemic, they weren't on their feet. So we have to work really hard to move forward and not just return to normal.
Thank you, Michael. Really, really amazing work that you're all doing. So the second question that I have for you is kind of in regards to space. So as we know, the Pride that we know was canceled this year. And I know that physical space dedicated to queer and trans individuals is so crucial. So how has that shifted in the virtual world, and in what ways are people finding community?
Yeah, through our entire history, queer spaces have been vital to our community. They've given us the opportunity to feel comfortable, to be ourselves in a world that often doesn't allow for such expression, or at least without fear of discrimination or the threat of violence. So with lockdown measures and social distancing, there are really 2 main things to consider. What do we do in the interim? And then how do we support our spaces so that they're there for us post-pandemic? Again, I'm the co-president for the NYU LGBTQ Alumni Network. So our aim is to connect alumni to each other, the university, and the larger community through programs and services. So most of our programs are events that occur in person. Some programs are easy to translate into the virtual space, like a panel discussion, much like we're doing here today. We did do a short pause on programming, but started back up in May with a family planning panel discussion. Since then, we've partnered with a club in LA to do a Pride Trivia Night. So that was a little bit of a global event, engaging alumni across the world. And we did a virtual tour of the Leslie Lohman Museum of Art. So the reality is currently that many people are experiencing Zoom fatigue. So we try and be very selective in the events that we do to make sure that they translate and are unique enough to provide real value to our network. I think the larger issue for queer spaces is whether they can weather the storm financially to be there for us when we return. I should also point out that when people think of queer spaces, they might gravitate towards nightlife establishments, but it's also community centers and healthcare centers and bookstores. These places support meetings for people who are in recovery or questioning their identity or trying to receive healthcare without judgment. So spaces are a vital lifeline to people who, like Renee was saying, might not feel comfortable or safe at home. In general, it's hard to keep any establishment open in New York City, add in lack of business and then restricted business as they start to reopen. So many are facing closure. So my recommendation to folks is to reach out to the spaces that you call home, check their website, email the owners, and ask how you can support to keep them, help them keep their doors open.
Thank you very much, Michael. Okay, I now have a couple of questions for Robbie. So Robbie, your role is working with internal medicine at NYU. What is the transition like for you from pre-COVID to now during COVID?
So I think that NYU did overall a phenomenal job of adapting to this pandemic. They were able to prepare very early. We were talking about this back in January. We were, stocking up on supplies. And when you look at outcomes, for example, we actually didn't really have that much difference in mortality based off of demographics. But we also are a very well-funded, well-resourced hospital. We have access to the most expensive, latest drugs. We had an entire surgical hospital that we could convert into a medicine wards. We have experts in the field. And I think that this is very representative of the two sorts of medical systems or classes that we have in America, and especially in New York City, a private and a public one. And so when you look at outcomes in the outer boroughs where they are under-resourced or they are underfunded, you do see this difference in outcomes. And I think that one thing that was kind of representative of this, sometimes this unawareness of the two systems that we have is, I remember one of our colleagues that mentioning, asking why weren't we hit as hard? Why is it that we're doing okay? We never had to triage vents or consider who can get what. And I felt like that was very reflective of the fact that sometimes we overlook how there seems to be two societies occurring simultaneously, one that is able to access resources and one that is sometimes ignored. Yeah.
Thank you. And kind of segues into the next question. So you've done a lot of research and experience looking at racial disparities among demographic groups and as it pertains to healthcare. Can you speak to how society affects people's health?
Yeah, so I mean, if you look at pretty much most diseases across the board, there are differences in outcomes based off of race or sexual orientation. So for example, the LGBTQ plus community is more likely to be affected by homelessness, domestic violence, substance dependence, certain cancers, etc. And when you look at Black and brown populations, they're more likely to have diabetes, obesity, kidney disease, and these are conditions that if you were to get COVID are more likely to have a bad outcome. And one statistic, infant mortality and infant weight, is actually very representative of how a community is doing overall, and that's how we tell how well a country's health is. And over the past decades, we've actually seen a widening gap between infant birth weight and mortality, as well as mother mortality during childbirth between Black and white communities. And so that is really, that widening gap is really a canary in the coal mine, in the sense that it's reflective of something very deeply wrong in our society, that there really truly is a difference in the care that different races or demographics are receiving. And I think it's easy for some people to dismiss that as, well, it could be genetic differences, but we have now, over the decades, really done a lot more research, and there's hundreds of papers showing that the Black experience in America is so stressful that there is a chronic flight or fight response where there's lots of cortisol, lots of adrenaline constantly flowing. And especially when a woman is pregnant, these changes can affect the infant. They're more likely to be lower birth weight. And when they grow up, there's a relationship to having higher rates of diabetes, heart attacks, etc. And so, and actually one thing that is interesting that kind of dismisses that this could just be solely a racial thing, solely a genetic thing, is that if you look at immigrant mothers from Africa who come to the US, and you look at their children's birth rate, similar to that of their white counterparts, but if you follow their children over generation, their children's birth weight tends to normalize to Black females. And there's an article that references that. So it goes to show that, again, the experience of being Black is in a way traumatic in America, that there is a difference for Black people living here compared to elsewhere. And so this brings us to COVID. And so I remember when the pandemic was first starting, being worried that the same reasons why minority groups are predisposed to having diabetes, kidney disease, these same predispositions would likely affect them if they were to get COVID. And this is something that we are seeing, that there are significant differences. So in New York, New York City is about 50% Black and Latino, but they account for about 60% of all the deaths from COVID.
Thank you for all that really thoughtful insight. It's a lot to take in for sure. So, but we appreciate you sharing that with us.
Yeah, it's our reality.
Yeah. Well, I'm glad we're talking about it here today with this large audience. So one final question for you for now is kind of about you and your role. So, you're on the front lines as a queer man. How has that identity played a role, if any, for you in your job?
Yeah, so I think that being both queer and a person of color, both historically oppressed groups, it is what has made me be interested in healthcare disparities in social determinants of health, and asking why they occur, and especially how do physicians specifically contribute to it. So obviously physicians aren't perfect beings. We've made terrible mistakes in the past, whether it be performing surgeries on Black people without anesthesia with an audience of physicians to study it, or to inject syphilis into Black men in Tuskegee, Alabama, to see the outcomes without their consent. And so by being American, we really are conditioned to be racist, to have implicit biases built into us, and I'm no exception to that. But I think that what at least my personal experience has done is it puts me in check, so that whenever I am encountering a Black patient, for example, I have to take a step back every time and ask myself, am I doing this for certain reasons? Would I be doing this if this patient were white? Am I saying that this person is non-compliant, or is there something else deeper going on? And I think that if more people were to expect that they are going to be biased to begin with, we could at least try to decrease the amount of differences in outcomes in the treatment that they get.
Absolutely. Great. Thank you so much, Robbie.
Mm-hmm.
And now I'd like to turn to Christopher. So Christopher works here with us in the NYU LGBTQ Center. And Christopher, I'd like to know, for you, your role was so student-facing. You were supporting students, uplifting them, empowering them in person, and now it's all 100% virtual. So how has that been? How are you doing with that?
Yeah, it has truly been a journey. It's truly been a journey. And as a person who has, studied higher ed in grad school, I think it's been really interesting to look at how higher ed and colleges and universities have been shifting their operations to fit our current situation. So as a professional, this has been a time where I'm striving to be as innovative and as creative as possible to ensure that we're, continuing to engage our students and provide them with opportunities, spaces, virtual spaces, to be with each other, right? And so something that has come up is the idea of accessibility, right? So on one hand, we have folks who are doing programming who are now thinking about, oh, we need to have closed captioning on our events. What does it mean for a person who is unable to be in a physical space? Now they're able to access these events, right? And so I think this pandemic has really opened our eyes to the need for virtual, virtual events and virtual initiative and things to be accessible virtually is a need, especially for the LGBTQ plus community. But then on the other hand, you have folks who may not be out at home and can't access, the spaces, or they utilize queer spaces in the center as a way to escape and to be around folks that where they're allowed to exist unapologetically. So it's been a back and forth, but I am excited to see one, the program that we are doing, which I'll talk about a little later as just a little shameless plug, but then also just the event that we're going to be doing for, moving forward. What I think this has really changed the landscape for programs, initiative, has made us lean on social media presence even more so. So I think it's giving us time to focus our energy and attention on other areas that we may have not been paying attention to pre-COVID.
I love the optimistic twist of it. So I really appreciate that answer. And to kind of set you up for a shameless plug. So the NYU LGBTQ Center has been doing so much pre-COVID, during COVID, but what does it look like this summer? What types of resources can students expect to see and programs to be a part of?
Yes, so the LGBTQ Center is a part of the larger Office of Global Inclusion, Diversity, and Strategic Innovation, which includes an OGI team, CMEP, and LGBTQ+. And so we're doing a myriad of events, initiatives, and just sharing resources. So some things that are coming specifically out of the LGBTQ Center, we have a monthly virtual space called Breathing Room, where students can come in and chat with someone from the wellness team, a grad student from the LGBTQ Center, and myself. And that's just a space to just bring all of yourself and have a conversation around, our experience as it relates to navigating this pandemic, as well as all the other things that have been following with that. We also have a little queer Netflix movie night situation. And so we'll be screening some amazing films on Netflix. So that's also just a space. I think conversations around healing and joy is just as crucial as resistance, protesting, organizing, all those things. So joy and community building need to be wrapped up all in that, because we can't pour from an empty cup. We have to make sure that we're full so that we can show up for other folks and show up for ourselves. So those are two things. And then obviously we have the rest of the event coming up this week, which I think a link will be shared in the chat of all the Pride Week events that will be taking place. And then folks should stay tuned for the fall. We're in the process of developing and brainstorming what that is going to look like, and I'm really excited about those events and initiatives. And then OGI also, if folks want to focus energy specifically on anti-racism education, there is a list of resources that that's been posted to the OGI website. So I really encourage folks to take a look at that. I think a big part of being an ally or an advocate or engaging in this work is really doing a lot of self-reflection and a lot of self-education. And you can't expect the communities that you want to advocate for or be an ally for to educate you on the issues. You need to come ready and ready with a base foundational knowledge so that we can continue to move forward. So I really encourage folks to take a look at those resources. They're really useful and very much needed.
Thank you so much, Christopher. And thank you to all four panelists for those conversations that we had. So with the final 14 minutes of the event, we're going to turn to some of the audience questions. So it looks like most questions are posed for the group. If we have one specific person, we'll call out their name. But for the group, so intersectionality is playing such a critical role, both in the work that you do and personally. Can you speak more to the ways that it manifests in your work and the importance of having an intersectional lens, especially maybe for folks that this is a new term for them? Maybe just kind of turn your mic off and you can start, and we have a couple people jump in on this one.
if it's okay for me to go. I think it's important because representation matters. So in the hospital, I think it's really important for staff, residents, and patients to make sure that they see diversity so that we can create a more inclusive environment. I think that as physicians, we like to think in algorithms and patterns, and sometimes, unfortunately, we reinforce biases or stereotypes in that process. And so by having more visibility, overall, I think that we can break down some of these stereotypes and prevent, disparities in care.
Yeah, thank you for that, Ravi. I absolutely agree. I really struggle sometimes with this concept of intersectionality, because I think what sometimes it ends up doing is centering that whiteness is the narrative that we are all prescribing to, right? And so then saying you have to introduce the other, right? It still creates inherent white supremacy in the way we talk about some of these things. For me, it feels disingenuous to separate the sexuality and gender from race and ethnicity, right? Because they so much inform one another. It feels impossible to disentangle, or it's doing a disservice in a mental health capacity, at least for me. So I really appreciate you talking about that. Like, this isn't like the addendum to the curriculum. This is like the necessary place from which we begin this work.
Thank you.
I can step in there. One of the biggest things that we're embarking on at New York Cares, and what we've always been trying to do, is to ensure that our volunteers, our staff, are representative of the communities that we serve. Nonprofits, by and large, typically skew to white in a lot of different roles, particularly as you go up in the organization. So we're taking the time to look at our organization to make sure that we're positioned and educated and addressing equity within our organization before we start to think about programmatic interventions more largely for the community. We work in a different way where we support other organizations that are doing frontline work by providing the volunteers. But that's some of the ongoing work that we're doing. And I think from my perspective, it helps that I have this LGBTQ plus identity, but also as a white male, I do recognize that that comes with a lot of privilege. And I'm glad that I have the empathy from understanding, being a minority on the other side, that it helps me to educate myself on how to support people of color and the communities across the city that we serve.
Thank you for that, Michael.
And I'll share real quickly. I think it's also important for folks to understand the difference between multiple identities and intersectionality. And so I would really encourage folks, if intersectionality is a new word for you, or if you need a refresh, because I think the term intersectionality has been used it's overused in a lot of ways, and I think some folks have lost the meaning of it. And it's really about how do those multiple identities play out in society, and what is that experience of that, having those multiple identities pack on. And so I would really encourage folks to look at that, and then also understand that intersectionality is messy, right? There are a lot of factors that come into intersectionality, and it's not going to be a nice little clean little package that you're going to be able to pass off to someone and have them understand the lived experience of someone. It's impossible. So I think folks need to understand that it is a messy process, and that's just the reality of it all.
Thank you. Very well said. Okay, so the next question that I have queued up here. So, should the Pride March happen outdoors this year? How do we balance movement, reinvigoration, which requires public presence, but also show respect to public ordinances for safe social distancing?
If it's okay. I think it's a tough question to answer, because again, representation matters, presence matters. but at the same time, we really do have to balance the public safety of it all, and that we will have a Pride March likely next year and the year after that and so forth. But this really is that exception. And so it may be hard right now. And I know it's also hard to see with all the protests and how much congregation there is related to that. But I think that prioritizing public safety in this case is more important right now.
I'll jump in real quickly. I think that I agree with Ravi. I think that we have other opportunities to march and to be physically together. I think this year is a great year to reimagine what does showing up for each other really look like, right? So I have NYC Pride is particularly have a lot of thoughts about it. But I think it is an opportunity to reallocate all the funds that are spent on those floats and promoting products that are sold to our community. How about you donate some of that money into the organizations that are doing the work? How about you donate that, those funds to causes that will uplift and empower our community? So I think it's really an opportunity to reimagine what does supporting the LGBTQ plus community look like? What does empowering the LGBTQ plus community look like? So I would encourage folks to really lean into that. And we can do the physical march at another time, but like, how can we show up for each other right now? What are the ways that we can do that?
Yeah, I really love that, Christopher. I think this is an important moment for the LGBTQ community as we reflect on Pride, to sit with ourselves and think about why we do this, why we hold space for Pride, and that Pride has evolved into a sort of corporate capitalist Pride trademark, rather than what would it mean to create community caring and support one another in these things that we're advocating for. So yeah, I really appreciate that.
Okay, so we're at 5 minutes left in the event. I do want to make note there have been lots of requests that we share maybe statistics or references from maybe things that our panelists have said. I can assure you we will collect any form of resource from our panelists, and we will compile them, and each attendee will receive an email at the end of the week with all of these resources and anything that's been shared in the chat. So you don't have to worry about writing everything down before we leave today. So the final question, which maybe each person can take half a minute to a minute, is what's next? So what are action steps that we could be taking, LGBTQIA folks, Black and Indigenous people, everybody, allies, what are steps we can all be doing to fight both the pandemic and also systemic racism and anti-Black violence?
I'll put my 2 cents in real quickly because it's not a lot, but something that I have really been thinking about as it relates to showing up for others is because I think a conversation that has been coming up for me in my personal life has been around protests, right? And like, go out to the protest, and I think there are multiple avenues of resistance. There are multiple avenues for organizing, and so I think the question should be like, how do you want to contribute to this, right? Like, what are the things what are your circles that you can influence, right? And so while protests have their place, I think at a certain point there is around sustainability, right? So what are the things that you can do in your everyday life that uplifts Black, queer, trans folks, right? If you work at a publishing company, are you reaching out to Black, queer trans writer? If you're working for a dance company, so I think it's like, people think that, and Renee, I think you spoke on a little bit, like this big A for advocate, and it's like, I have to make this grand gesture. It's like, girl, no, you don't. All you have to do is look at what are the things that in your everyday life that you can do to uplift the voices of Black, queer, and Black, queer, trans folks. So that's my 2 cents. What are the things in your everyday life that you can do? What are the things that you have control and power over? And how can you infuse the stories, the narrative, the magic that is Black, queer, trans folks? So I'll leave y'all with that question.
Thank
And
you.
I'll jump in and add that one of the things that you can do is to volunteer. Not to be grim, but a lot of the federal aid, state aid that we've been receiving will be expiring in August. And we'll start to really experience a lot of the effects that the pandemic has done on a lot of the residents of the cities, particularly people of color, and our LGBTQ plus community. So the economic hardship is going to be exacerbated around that time, and food insecurity, all the economic things that I talked about previously, people will need your help. So there's easy ways to get involved. If you have the privilege of being able to volunteer your time, there's many organizations that we've shared earlier. Also, if you aren't able to give your time, but you want to support an organization, nonprofits are struggling at the moment because most of their support does come from corporations, which are also down. So there's lots of different ways that you can help those who are struggling, and just show up for each other. I think through education, through volunteering, through support in other ways, financially if you can, those are all ways that you can help.
Thank you, Michael. And I see that the chat's going off. Our friends on the backside of this event are putting in a bunch of links to other places you can volunteer.
Just really quickly. So I think that, going forward, so awareness is always going to be the first step. And that means that we take the time to listen to each other. And, I'm all for, dismantling the chains of white supremacy, but I think it's important to remember that white people in this country do struggle as well in economically or in other ways. And that ultimately we define how we want to live as a society. So policies matter, and that means that voting matters too. So being open to hearing each other, but also translating that into political force as well.
I think the only thing that I would add, and I know Christopher and Robbie, you touched on this a little bit, is like is really examining and dismantling the system is a long-term project. And so thinking about what changes that you can make. Yes, going out and protesting feels immediate and gratifying, and also what changes can you make that are sustainable? And so does it mean, thinking about how you're having conversations with the folks that are close in your life? Does this mean buying or banking Black? Does this mean, what are those things that you can do that will have a long and lasting impact that you feels within your realm of safety to do?
Thank you all so much. As I said in the beginning, we tried to tackle an entire collegiate course in an hour. I think we did a pretty fair job, but hopefully this is just the beginning of conversations for you and your friends and your family and your coworkers. And we've just given you some things to think about, but you can take the resources that we're giving and run with them. You, as I mentioned, will be getting an email with all of the links. And I know the chat's been blowing up with all those links, so you'll be getting that. You'll also have my email address on there too. So if you feel like we had a lot of folks here today, we couldn't get to all the questions, but if there's something you still want to talk about, you can go through me and I can see if I can connect you with one of the panelists or if we can answer your questions. So feel free to email me. You would have received email me from before, so you have my email address. But I just want to give a little round of applause to the 4 of you for being here today. It's such challenging times we're in right now, but to give your emotional energy and your time, it's greatly appreciated. A huge thank you to the NYU LGBTQ Plus Center. You all were a dream team to work with to make this event happen. And a huge thank you to the Center for Student Life. And thank you, attendees, out here on Zoom on a Monday night. It's Monday, right? Yeah, I think so. So thank you for being here and engaging in this conversation with us. We really appreciate you and hope that you have a very healthy week and enjoy Pride. Have a good night, everybody.